All right. So we did our wiki project on thermoclone VPS impression material. My name is Kush.
My name is Tom.
My name is Jessica.
My name's Edward.
And my name is Victoria.
All right. So Ultradent thermoclone VPS impression material is used to make dental impressions, especially for capturing accurate molds in restorative and prosthetic procedures. These include, but are not limited to crowns, bridges, and implants. And important properties and features of it are thermal accelerating setting, hydrophilicity, high tear strength, and excellent dimensional stability and thixotropic properties. So for a thermal accelerated setting, it remains workable at room temperature, allowing for an extended time for clinicians to be able to work with it. But once it's in the mouth of the patient, the body heat accelerates the setting process. And for hydrophilicity, uh, it effectively displaces moisture and adapts well in a wet environment. And for the high tear strength and excellent dimensional stability, it's resistant to tearing, which allows for removal from the mouth without distortion or damage. And for the dixotropic properties, it allows to flow in the spaces between teeth to capture every detail and including the margin.
All right, so here we discuss the significance of the new and improved features that the thermoclone impression material has to offer. So first we start with consistent setting times for impression materials that are crucial because they ensure predictable handling, accurate detail capture, and minimal patient discomfort. This consistently allows dental professionals to confidently work within a set time frame, reducing the risk of errors and improving the quality of the final impression. Next, we have the thermal set curing that activates in the patient's mouth, which is significant because it allows the material to begin setting only when at body temperature, ensuring much more control over working time. This minimizes premature setting, allowing precise detail capture, and enhances patient comfort by reducing the risk of distortion during placement. Next, we have the unique dynamic tip that simplifies installation by improving material flow and placement accuracy. This makes the process easier and more efficient than with competitors. This design reduces user error and enhances precision, leading to a higher quality impression with minimal effort. And next, we have a bubblegum scent that makes the impression material more pleasant for patients, particularly children, reducing anxiety and discomfort during the procedure. This simple feature helps create a more positive experience, encouraging patient cooperation. And next we have the hydrophilic impression material that improves precision by effectively displacing moisture and capturing the fine details even in wet conditions. Next, we have a high tear strength and excellent dimensional stability to ensure that the impression material remains intact when removed and it retains its shape over time. This durability minimizes distortions and inaccuracies, resulting in precise, reliable impressions and fitting dental restorations. And lastly, we have the feature of extreme temperature sensitivity in the impression materials that allows for a longer working time and a short setting time, reducing the period in the critical zone where distortions are more likely. And at the bottom of the slide, we see that the thermoclone offers the unique feature of up to a 1 to 30 working time shown on the left, compared to an average of only 35 seconds with competitors, which is shown on the right. This extended working time, as said before, combined with a shorter setting time, significantly enhances the quality of impressions.
So some important factors to consider about this material. Again, as Tom was talking about, timing characteristics. So we do have a higher working time with this product, around 1 minute and 30 seconds, but do keep in mind when you're using that product how long that goes. There's also quick setting time, so it does rapidly set in the patient's mouth. So just be ready to have that as soon as it enters there because it is thermal set. The critical zone is between 1 minute 30 and 3 minutes. So this is the time period where distortions most often occur. So have to take more caution because if the impression is not good, then you will have extra lab work, poorly fitting restorations, and costly retakes, which nobody wants. In addition, accurate mixing is important. So if you're manually mixing it, be cautious that the two components are thoroughly mixed in the correct ratio. Improper mixing can affect the setting time and final impression accuracy. If you're using an auto mix system, make sure that the cartridges are properly loaded into the gun and use a new mixing tip with each use to ensure that there's a consistent flow and a proper mix each time. This will prevent air bubbles or uneven distribution of the base and catalyst. And on the right side are the different mixing ratios for the different types of impression material that thermoclone offers. In addition, it's important to keep in mind when you are handling difficult areas, take more caution. If the patient has deep undercuts or intricate areas of the mouth, it's important to be extra cautious when removing the impression to avoid tearing or distortion. As said before, thermoclone impression material is tear resistant and has high tear strength, but still delicate handling is still required, especially around margins or small intricate areas. If the impression does cover multiple areas, example, full arch or quadrant, make sure to pay attention that the details do cover the entire surface and every detail is covered.
So when selecting dental materials, obviously it's very important to consider products from different manufacturers. And one competitor for our product is Kerr Take One Advanced Vinyl Polysiloxane Impression Material. This is also a vinyl polysiloxane material, so it shares a lot of characteristics and properties that are positive in impression materials, such as high tear strength and elongation, hydrophilicity, and dimensional stability, which have already been mentioned. One thing that stood out was Kerr Take One Advanced VPS has highly advanced contact angle, which is much lower at 10 degrees compared to thermoclone. However, both do emphasize great hydrophilicity, and both products offer a variety of options when it comes to viscosities and setting times, with thermoclone offering shorter setting times at 1 to 2 minutes and 2 to 3 minutes, and Kerr Take One Advanced VPS offering 2.5 minutes for the shortest setting time and 4 and 5 minutes for the longer setting times. And as thermoclone is a product that highlights its thermal acceleration, this is a property that our competitor does not possess, and that would be the greatest motivator in selecting thermoclone over other competitors. When it comes to cost and ease of use, both are similar. We can see the costs here. And one of the things mentioned was actually the flavor, which is more appealing to, particularly to younger patients who actually have it backwards, but thermoclone has a bubblegum flavor, while Kerr Take One does not offer this flavor.
Now, in terms of if we recommend this product for use in a general dentistry practice, we would say yes, we do recommend this product, mainly because of a number of properties of this product that help enhance its ability to generate an accurate impression and also enhance patient comfort. The high tear strength and hydrophilicity allow the material to get into all the nooks and crannies and generate an accurate impression. This product is also great for providers since it allows for a lengthy working time while outside the mouth, and then has a thermal accelerated set, which allows the patient to not have to sit with the impression in their mouth for too long. And also, the bubblegum flavor is also very beneficial for improving the patient's experience of getting the impression, as opposed to some other impression materials and other dental materials in general that might have an unpleasant taste. So overall, we would say this product seems to allow the provider to efficiently generate an accurate impression while also enhancing patient comfort. So that is why we would recommend this product in a general dentistry practice. And lastly, this product was released by Ultradent on November 11th, 2016, which is approximately 8 years ago. And here are our references, and thank you so much for listening.